Hello, everyone. Welcome back to another episode of Doctors Go Live with me, Nina Cheryl Khan, your host. Now, if you're tuning in right now, let us know in the comments section and let us know where you are tuning in from because in today's episode, we're going to be talking about the ICU. Now, how many of you have actually had a loved one in the ICU before? Let us know in the comments, all right? Now, whether you've had a loved one in the ICU, just the word ICU already sounds scary, right? Well, for me, it does. Now, in fact, for many families, the ICU can feel very intimidating, confusing, and even overwhelming. All right. So, in today's episode of Doctors Go Live, we're going to be joined by Dr. Adlina Hisyamuddin, consultant anesthesiologist and intensivist from Columbia Asia Hospital Tebrau. And she'll be sharing with you behind the doors of the ICU and uncover what actually happens in there. What goes on inside the ICU? What do the machines and monitors actually do? Who makes up the ICU care team? And most importantly, how can families best support their loved ones during such situations? All right. So that's what's happening today, folks. We're talking about understanding the ICU, what's going on in there. So, what would you love to know in today's episode? Ask us all the questions. All you have to do is just type it in the comment section, and we're going to go and answer it after the Q&A. Right now, speaking of questions, how many of you guys are excited to win and you love excited to win some quiz prizes and you love quiz questions? All right, now if you share this video out, you're going to be eligible to join our Doctors Go Live quiz, which is happening right at the end of the Q&A. And today we've got some amazing earbuds up for grabs. So if you're into that, please do tune in because we'll be able to give you some questions. You'll be able to win them. All right. So make sure you hit that share button, tag your friends, and stay with us all the way until the quiz question. Now, all of this is happening right here on Doctors Go Live with me and our special expert for today. But before that, let's take a look at this quick video, shall we?
Setting the pressure now, just a little more. Okay, vitals are stabilizing. Good. Let's keep a close eye on the saturation.
When a family member is admitted to the ICU, it can be very scary. You walk in and see so many machines, hear alarms, and your loved ones may be attached to feeding tubes and wires. It is completely normal to feel worried and confused. I'm Dr. Adlina Hisyamuddin, consultant intensivist and anesthesiologist at Columbia Asia Hospital Tebrau. Join me in the next episode of Doctors Go Live, where we will explore on what's really going on in the ICU, what family members can expect when the loved one is being admitted, and how they can help in the recovery process.
Well, there you have it, folks. Just the music itself is so scary. You think you're actually in one of those, intense thriller movies kind of thing, right? Okay. So welcome back. If you just joined us, you're watching Doctors Go Live with me, Nina. And today we're going to be talking about understanding the ICU and what exactly is going on in there. And joining us to break it all down, please welcome our special guest for today, Dr. Adlina Hisyamuddin, consultant anesthesiologist and intensivist. I hope I'm pronouncing it correct. From Columbia Asia Hospital Tebrau. Please welcome her. Hi, Sea Stars. Hi, Doc. Welcome.
Hi, everyone.
Thank you so much for joining us. First of all, Doc, your title betul ke? Is it consultant anesthesiologist and intensivist? Betul tu?
Yes, betul. Betul.
Walaupun dah intense. What does intensivist mean, ya, Doc, if you could share with us?
Well, an intensivist is actually my role as an intensivist is mainly caring for the critically ill patients in the ICU, providing advanced monitoring and life support treatments while working closely in a multidisciplinary team in the ICU.
I see. Okay, so you're the main person kind of thing. So thank you so much for joining us, Doc. Now, before we go into the questions here, Doc, just want to say hi to a couple of people who's here. Hi, Sea Stars, Norazam. So nice to see you guys again. We've got Dr. Adlina here, so we're going to be sharing about some stuff that goes on in the ICU. But before that, just want to ask you, Doc, if you could share with us oh wait, before we jump, just to share with everybody, right at the end we've got the Doctors Go Live quiz, where today you can win some earbuds, so do pay attention to Dr. Adlina because she could help you win some earbuds. And of course, if you have any questions, just feel free to type in the comment section and we'll get them answered after my interview with Doc. All right, so Doc, before we go into those juicy questions, first of all, can you share with us a little bit about yourself, how you got started into the ICU part of things, and how did you get into it, and what exactly do you do?
Okay, hi, I'm Dr. Adlina Hisyamuddin, intensivist and anesthesiologist from Columbia Asia Tebrau Hospital. I completed my medical degree and master's in anesthesiology at University Kebangsaan Malaysia before pursuing my subspecialty training in adult intensive care. Well, my interest in intensive care started way back during my housemanship training in 2003. That's about 23 years ago, where I was a house officer in the medical department and I was posted to the ICU. What attracted me to this field was the combination of complex medical decision making, teamwork, and the comprehensive care that can be provided through intensive care. And
Wow.
I always like to think that ICU is your last line of defense, where specialized teams, advanced technology, and intensive monitoring come together to give the most ill patients the best chance of recovery.
See, okay, so that was what got you inspired, and that is what you do, yeah, Doc.
Yeah.
For I think for our viewers out there, why do you think we're talking about this episode? What do you think is important for people to understand about what happens in the ICU from your point of view?
So most people only encounter the ICU when a loved one is being admitted and when they have a loved one who's seriously ill, which can be a very stressful experience. To have exposure to ICU at that point in time could be quite overwhelming. So if they can learn at this point where they are still relaxed, they don't have a loved one there, get to know what ICU is all about, this can help reduce anxiety and misconceptions. It also
Yeah.
highlights the dedication of the healthcare team and help family better understand the challenges that the ICU team faces when dealing with critically ill patients.
Okay, got it. So basically, if it's to help them prepare, kind of thing, so that you don't go straight into a horror. It can be managed. It's more relaxing and not so scary, lah. Put it that way, right, Doc? Okay, cool. So, Doc, one more question before we go in. What do you think are some of the biggest misconceptions people have about the ICU that we can handle in today's episode that you would like people to know?
Okay, one of the common misconception is that everyone admitted to the ICU is near death. While most patients are critically ill, they may have a good chance of recovery and they may only require temporary organ support and they will go on to recover well. That's one misconception. Yeah. Another
Okay.
misconception is that the machines are doing all the work. In reality, ICU team is actually a team effort involving doctors, nurses, therapists, pharmacists, and many others working together around the clock.
Okay, sounds good. Okay, so there you have it. If you think that ICU is the last case, a scenario where definitely whoever goes in there is gonna kick the bucket, that's not the case. A lot of people actually live and go on. So that's what today's episode is about. So we can get into it. All right. So let's look at the overview, yeah, Doc. Let's have the slides up. So what will we actually be covering in today's episode, Doc?
So today we'll be talking about what the ICU is, who works in the ICU, the equipments commonly used, the procedures commonly performed, and how families can be involved in patient care, and what recovery looks like after an ICU stay.
Okay, fantastic. So let's get straight into it then with what exactly is the ICU, Doc?
Okay, the ICU or the intensive care unit is a specialized hospital unit that cares for critically ill patients. It provides advanced monitoring and life support treatments for patients with serious or potentially life-threatening conditions, with trained healthcare professionals available 24 hours a day.
And the focus is on?
So the main goal of ICU is to stabilize the patient with critical illness, continuously monitor them, and provide rapid intervention when needed. Support is given for failing organs such as the lung, the heart, the kidney, the liver, while treating the underlying illness and giving patients the best chance of recovery.
Okay. And Doc, you mentioned earlier that it's not just critically ill or people who go to the ICU, it's not just critically ill. Some of them go on. So, what kind of cases do you get in the ICU, or who gets admitted to the ICU, Doc?
Patients are admitted to the ICU when they require intensive monitoring or advanced organ support. So this includes patients with severe infection, major trauma, cardiac emergencies, multi-organ failure, and those needing ventilatory support or breathing support. And also those needing medications to support their blood pressure when it is dangerously low or extremely high, or even dialysis or renal support. There are
Okay.
also cases where some high-risk surgical cases may also require ICU care after surgery.
Okay. So, Doc, in terms of your experience in the ICU, and maybe this will help the viewers understand as well, because there was a lot of terms there. What kind of people and what kind of cases do you see a lot in the ICU? In simple
Mostly,
layman terms.
those who have very severe infection, very
Okay.
severe infection.
Severe infection example?
For example, from the lung, from the liver, even from the urinary tract.
Okay.
So when you have severe infection, the whole body is affected. So it affects all your organs. Your organ will start failing. So that's when you need this advanced organ support.
Okay. So most cases yang masuk your ICU is infection lah. Any other, Doc, in your experience? 20
Um,
years?
There are also trauma cases like motor vehicle accidents, the ones with polytrauma. They have injury to the lung, they have injury to the long bones, they have injury to the liver, the kidneys, those kind of
Okay.
things.
So when you say trauma is basically yang injured, yang ada accidents lah.
Yeah.
Okay.
Yes.
Any other cases, Doc?
Sometimes patients who undergoes major surgery, for
Mhm.
example, thoracic surgery, or patients with multiple comorbidities, they have a lot of medical illness. They are also high-risk surgical patients. They are also admitted to the ICU post-operatively.
I see. Okay. So the ones from the post-operative, is it standard that they all go to the ICU for monitoring, or it's
Not
when
really.
cases? Sorry, say again?
Not really, not really. It depends
Not
on
really.
the patient, yes, intraoperatively.
Okay, got it. All right, let's go on to the next question. So, when we talk about the ICU team, who normally makes up the ICU team? Maybe you can share with us.
So the ICU team includes intensivists, anesthesiologists, specialists from various disciplines, medical officers, critical care nurses, which is a big part of ICU, I feel, critical care nurses, pharmacists, physiotherapists, dietitians, occupational therapists, and even support staff like the staff on the radiology department or echocardiography technicians. As you can see, it's a huge team.
So, are they there 24/7? I mean, this team is there at the ICU 24/7, is it?
The critical care nurses and the doctors are there round the clock. But
Okay,
the other teams, that the support teams, like the physiotherapists, they will come routinely on their schedule. Depends on
I
their
see.
schedule.
So, that one is they come in depending on the cases. Lah.
Yeah.
Okay.
Yes.
Gwen is saying hi, Dr. Adlina. Okay, kind of thing. All right. So, how do these different specialties work together to care for the patient, or and who usually coordinates the overall plan? Perhaps you can share with us that one.
So critical care is very much a team effort. Each member contributes their expertise, and we communicate regularly to ensure every aspect of the patient's care is coordinated, and it is usually done overall by the intensivist while working closely with the primary specialists.
Okay. And are intensivists usually anesthesiologists, or it can be anybody who's interested?
Well, at the moment in our country, we have we have intensivists with background of anesthesiology, like myself. We also have internal medicine specialists, they're physicians, and then they take that specialty in intensive care. And we also have emergency physicians who does
I
that specialty in intensive care.
I see. Okay, okay, that makes us true. That makes gives a clearer picture. Let's talk about the equipment, yeah, Doc. I think that either fascinates or scares a lot of people, right, Doc? The
It's
machines.
a very
Yeah,
busy picture. Yeah.
yeah.
As you can
What's
see from the picture,
yeah?
there's
What's
so
the
many
most
equipments.
machines, Doc?
So there are so many equipments commonly used in the ICU. The most common would be the bedside monitors, the ones that monitor your blood pressure, your heart rate, and also the ventilator, the breathing support machines, and infusion pumps. That would be the most common ones, I would say.
Okay. And I guess we'll go into the details. Yeah. What part of the machine does it usually scare people? How, in your experience?
I think because seeing that only one patient with so many machines surrounding them, that's very intimidating, I feel, to the family members. Yeah.
Okay. So, what message would you like to share with people about this so that
I would
it's
say
not so shocker horror kind of thing?
I would say, don't worry. They may look intimidating, but those devices provide life-sustaining treatments, and it's needed to help us closely monitor the patient.
And only for that point in time, right?
Yes, yes,
A lot
yes,
of people recover, right?
yes, yes.
Okay, let's look into the machine specifically. The hemodynamics monitors. What is this? Nama je dah macam whoa. So could you share with us, Doc?
So a hemodynamics monitor, it continuously tracks the patient's heart rate and blood pressure. It also monitors the patient's oxygen saturation and sometimes more advanced cardiovascular measurement like your cardiac output, your stroke volume. It allows us to detect changes in the patient's condition immediately and intervene so that intervention can be provided quickly.
Oh, this is like probably the most basic
Yes.
equipment, right? Kind of thing. Yang kalau you buat movie kena ada benda ni kan.
Yes, and it also measures it beat to beat. Every beat of your heart too, it measures the blood pressure.
Okay, got it. And this is the one. How is it connected to the patient? Yeah, this is using that thing kat jari tu ke?
That one is oxygen saturation. You have to insert a catheter for that into your vessel.
Okay, catheter tu yang macam
Jarum tu.
okay, got it.
The jarum.
In case people are wondering kan. Okay.
Yeah.
What about the ventilators and breathing support?
So a ventilator is a machine that helps patient breathe when they cannot do so adequately on their own. It delivers oxygen, helps remove carbon dioxide, and reduces the work of breathing while the patient's lung takes time to recover. So once the patient improves, we will gradually reduce the support and subsequently remove the breathing tubes when it is safe to do so.
Okay. So does everybody get this or it depends on the case?
No, it depends on the patient. If they have inadequate breathing, their oxygen level is not adequate, then we may need to put a tube in to help them breathe.
Okay, so let's look at the next machine. This is an infusion pump. What is an infusion pump? What do they do?
So infusion pumps deliver medications and fluids with great precision. In the ICU, we use them to administer treatments such as sedatives, antibiotics, and medications that support blood pressure. They help to ensure patients receive the correct dose safely and accurately.
Okay. So this one is connected to the patient through the jarum again.
Yes, yes.
Okay, got it. Okay, and I guess the next one is the kidney support machines. Can you share with us more on this? And why would a patient need it?
So in the ICU, some patients develop acute kidney injury due to severe infection, for example, or shock, major surgery, or other critical illnesses. Now, dialysis machines temporarily take over some of the kidney's function by removing excess fluids, toxins, and waste products from the blood while the kidney takes time to recover.
Okay, so this one, not everyone, and temporary lah, I guess.
Yes.
Okay. So now we've looked at the machines, right? Next is common ICU procedures. Let's talk about this. What are some common ICU procedures? Yeah, Doc? I think the first one would be the hemodynamics lah kan?
Yes, betul. So with regards to hemodynamics, common procedures involve inserting catheters, like I mentioned earlier, to monitor and manage how blood circulates throughout your body. So in the ICU, we often insert arterial lines and central venous lines to continuously monitor blood pressure and assess the circulation. This helps us make timely decisions about fluids and medications that support the heart and the blood vessels.
Okay, got it. So this makes it even more clearer with the machine yang we spoke about lah. The next is to do with the respiratory machine, right? The ventilators and support. So what would be the procedure with this?
So in terms of respiratory support or breathing support, common ICU procedures include insertion of an endotracheal tube or a breathing tube to help a patient breathe adequately. We perform procedures such as, we also perform other procedures such as airway suctioning or chest drain insertions when necessary to help improve the breathing and oxygenation.
Okay, got it. And the next other common procedures would be?
Other common procedures include insertion of your feeding tubes to deliver nutrition to the patient, urinary catheters for precise monitoring of the patient's urine output and kidney function. Other procedures include blood transfusion and also lumbar puncture, where we examine the patient's spinal fluid for diagnosis and treatment.
I see. Okay, got it. And of course, I think one of the ones that we always watch in movies and series, ER, that would be CPR, right, Doc?
Yes, betul.
Okay. Could you share with us more on this?
So regarding CPR, fortunately, CPR is not something we perform regularly in the ICU. Now, the principles of CPR itself is basically the same everywhere, except that in the ICU, the advantage is we have more advanced monitorings, equipments, and medication, and a specialized team to support the patient. So you can say that it's a CPR in an advanced setting. CPR is one of the most common emergency procedures. It involves chest compression and it also may include cardioversion or defibrillation. Because critically ill patients can deteriorate suddenly, team members are trained and prepared to respond immediately when it is needed.
I see. Okay. And this is, even though it's an advanced setting, do you guys do manual or macam mana? How is it done?
Manual, usually in the ICU manual, but there are some centers they have automated machines to perform the CPR. I have
see.
seen it being done in the ED, these automated machines.
Okay. Is the machines better or sama je dengan manual?
I think if it's done properly, then it doesn't matter as long as it's done properly. Yeah.
Okay, got it. So now let's take a look at mobility and positioning, right? So now that we know the common procedures, what do we mean by mobility, yeah, doc? Is it important even in ICU? I thought, ICU tu duduk je lah diam-diam kat situ and recover. So could you share with us what that is?
So like Nina, many people are surprised to learn that movement is actually an important part of ICU care. Even
Yeah.
critically ill patients, they benefit from appropriate positioning and early rehabilitation, which can help improve recovery and prevent complications.
I see. Okay. So how early do you actually start this? Just wondering what does it include?
So when a patient has critical illness, they can develop rapid muscle loss and weakness. So early mobilization helps prevent muscle wasting, prevent formation of blood clots, prevent pressure injuries and long-term disability. Depending on their condition, some patients can begin simple exercises like sitting up on the bed, sitting up at the edge of the bed, and even standing and walking within days of ICU admission under close supervision. Even unconscious patients or patients on breathing tubes will have chest and limb physiotherapy done to them when it is safe to do so.
Right.
As you can see, yeah.
If they're not conscious, a therapist can do it lah.
Yes. They are called passive movement. So that will help the muscle to exercise. Yeah.
Okay.
So as you can see from the diagram, right, Nina?
Yes.
Critically ill patients, they are prone to get pressure injuries, especially at their bony prominences, at the elbow, at the knees, and the heel. So with movement and with positioning, we can prevent these injuries.
Okay, when you say pressure injury, tu macam mana? Because I think there's a lot of people tuning in, they might not know what that is.
So what is pressure injury? Pressure injuries, sometimes they are called pressure sores or bed sore. They will call it bed sores. So this bed sore, they tend to develop when patients remain in one position for prolonged periods of time. So when they have this pressure injury, the skin breaks, they are more prone to get infection.
Okay, and you mentioned just now that muscle loss happens very fast, right? Like,
Yes.
what's the reality of it? How fast do you lose your muscle? If you could share with us some data so that people understand the importance of early mobilization.
There is actually a quantitative measure to that, but what I can say is it can happen within days or weeks. When the patient is critically ill and they don't mobilize, you can see the muscle atrophy, you can see the muscle wasting, even on the face. You can see that temporalis muscle starting to be lost, and you can see that they are becoming thinner.
Okay.
It can happen within days.
Okay, got it. So, all right. So that is on early mobilization. Just to clarify a question, Muhammad Syamil punya soalan is, Doktor, maksudkan ditidurkan tu macam mana? We're not going to answer it now, but maybe Syamil, you can clarify what you mean by ditidurkan, so that when we do answer it, it's clear lah. Yeah. Okay. Now the other thing is positioning, right? Pressure injury prevention. I think this is the same thing, ke, Doc?
Yes, sama, betul.
Okay.
This is
Anything
how
you
this
want
is how we prevent lah. We frequently
Ah.
position patients who cannot move by themselves, critically ill. They are intubated. They have a breathing tube in, so they will be frequently repositioned. Every 2 hours, the nurse will turn them.
Okay, got it.
2 hours on one side, 2 hours on one side, to make sure that the skin integrity is intact. Yeah.
Okay. And when we talk about special mattresses and cushions, what would they be, Doc? Could you share with us?
Those are called ripple mattresses. So they provide vibration, so they maintain circulation to the skin and prevent skin breakage.
Okay, so these are like the ones with the pump and angin
Yes,
inside,
yes.
right? Yang ada
Betul.
bubble-bubble gitu.
Yes,
Yeah.
yes, betul.
Yeah. They're not expensive, so that really helps, especially if they're staying too long in the hospital,
Yes.
right, Doc? Yeah. Okay. Yeah, and of course massaging and all that kind of thing pun help juga kan?
Yes, betul.
Okay, cool. So next, let's look at medications. Medications, right, Doc? What can you share with us? What do we need to know about medications?
So common ICU medications include pain medication, sedatives, antibiotics, insulin, and medications to control blood pressure, and also vasopressors and inotropes. These are medication to make sure your blood pressure is maintained at a safe level. It helps support circulation in the critically ill patients.
I see. Okay, so let's look at the pain medications and sedatives. What do we need to know about this, Doc?
Okay, now comfort is an important part of ICU care. So pain medication, it helps relieve pain, which can be caused by the presence of your breathing tubes or even catheters. Now sedatives is used to reduce anxiety, improve comfort, and help patients tolerate treatment such as mechanical ventilation. So we carefully adjust this medication to achieve the right balance between comfort and safety.
Okay, got it. In the meanwhile, yes, if you guys have questions about the ICU, about Dr. Adlina and what she does, please let us know in the comment section and we'll get them answered shortly. Yeah. Next, Doc, your role, I think this is one of the more interesting ones. Yeah, the role as
Yes.
family member and how can I help my loved ones? What can you share with us about this? Yeah, Doc?
Okay, one of the most important things family can do is simply be present and supportive. Talk to your loved ones, offer reassurance, share important information with them about the patient with the healthcare team, and participate in discussions about their care. Even when the patient appear unconscious, familiar voices can come and reassure them and can be very comforting to them.
Okay, got it. So now we're going to look into ICU delirium, right, Doc?
Yes, betul.
Okay. What?
Now ICU.
Yes.
ICU delirium is actually a temporary state of confusion that can affect critically ill patients. They may become disorientated, restless, sleepy, or even experience hallucinations. It's usually related to the illness itself, but it can also be contributed by the medication, sleep disruption, or being in an unfamiliar environment.
Okay. So this means that siapa yang masuk ICU could have delirium, right?
Yes, they are at risk of getting delirium. They are actually a few risk factors to delirium. Yeah.
Okay. In your experience, berapa banyak percentage of the patients have this? Banyak
Oh,
ke?
I would say about 50%, 50 to 60% will have
Wow.
delirium. Yes.
And the main cause is, in your experience?
It is actually depending on the severity of the illness. The more severe you are, the higher the risk of you getting delirium. Number one, the more comorbidities you have, the higher your chance of getting delirium. Maksudnya, if you have diabetes, hypertension, kidney failure, the more diseases you have, the higher your chance of getting delirium.
Okay. So what can family members do when they have their loved ones in the ICU and they're having delirium?
Okay, families can help by calmly reminding the patients where they are, what day it is, and why they are in the hospital. Orientate them regularly. They can bring glasses, hearing aids, family photos, or familiar items. That can also help the patient. And most importantly, speak in a calm, reassuring manner and avoid arguing with patients about things they may be confused about.
Okay. You rasa this one is what you also shared ke? You want to share some more this one, Doc?
Macam mana tu Nina? Sorry.
Oh, sorry. This one you shared already, right? Ask
Uh,
question.
yes, family involvement. Ya, betul sama.
Okay,
Aha.
Doc, I nak tanya you. In terms of patient, siapa yang lagi delirious? The family member ke the patient? Ada tak yang the family lagi kacau or delirious daripada the one yang admitted?
I mean, critical illness is affect the whole family. We are not just treating
Yeah.
the patient, we need to consider the family member. So it's understandable that emotions can run very high. I mean,
Itulah.
yeah, delirium is actually a diagnosis. It's actually a legit diagnosis. So it's actually
Okay.
experienced by the patient. Yes.
By the patient, not the family members. Yeah,
No,
just
no.
to
The family is very emotional, I would say. They are stressful, they are very emotional. But what's important is communicate openly with the healthcare team. Ask questions when you're unsure and avoid relying on unverified information, especially from social media or internet.
I was about to say Google, you mean, and all these
Yes. So
AIs,
so
right?
yeah, so I feel trust and communication goes a long way in helping a patient, I feel.
Okay.
Yes.
So
Bersangka
you
baik lah, bersangka baik with each
bersangka
other.
baik. Yeah, yeah, yeah. I think the best thing is because everybody is trying to help, right? So bersangka baik
Yes,
and help each other and communicate a lot because
betul.
even if we speak the same language, kadang-kadang benda tu tak come across. Betul tak, Dok?
Ya, betul, betul.
Lain yang
Because
masuk, lain yang keluar.
yeah, betul. And because at the end of the day, our ultimate goal is what's best for the patient. That's what most important.
Yes. Yeah.
Uh-huh.
Okay. Got it. Now, let's look about patient safety. And one of the first things about safety is infection prevention and visiting the
Yes.
ICU, I guess. So, what do we need to know, yeah, Doc, about patient safety?
Okay, so what family members can contribute in ensuring patient safety is it means that when the patient is ill, their immune system is down and they are fighting for their life to recover from their illness. Therefore, we do not want them to be exposed to more harm, especially infection from the community or even in the ICU environment. So, patient safety is always our priority. Family members should practice good hand hygiene before and after visiting, avoid visiting when they are unwell, and follow any isolation precautions if required. Visiting policies also help ensure patients receive adequate rest and treatment without unnecessary interruptions.
Okay, so there you have it. So make sure you follow. Help the hospitals keep everybody safe and tu jangan cari gaduh basically. Betul tak, Dok?
Betul.
Yeah. Okay. So isolation rooms, yeah, Doc. What do we need to know about isolation rooms?
Okay, now isolation rooms are used for patients who are either having highly contagious, life-threatening infection to prevent the spread to others around them, or patients who are severely immunocompromised, meaning that their immune system is severely impaired and they are highly prone to get any form of infection, usually by organisms that doesn't cause infection in healthy individuals. They tend to get that infection. So special precautions are usually undertaken when caring for these types of patients.
Okay, so ni yang special case that can get infected by things that other people don't, right? Kind of thing.
Yes.
So need special care. Okay, and visiting guidelines. What can you share with us, Doc?
Okay, now I'm just going to mention some basic general visiting guidelines, which include limit the number of visitors, respect ICU schedules and patient ongoing treatment and management, do not take photos, and always try to maintain a calm environment.
Okay, I don't know why some people like to take photos. Yeah, Doc. I mean, not everything needs to be updated on social media. There's this thing
So,
about respecting privacy and stuff like that. Yeah.
yes, yes. It
Yeah.
could be misinterpreted also. Yeah.
But can you share with us what misinterpreted could be? In the cases that you've seen, because you certainly have more experience than we do.
Like when we're doing, for example, right, when a patient is on a breathing tube and we're doing suctioning and they're gagging on the tube, right? So they must be they may people may think that they are in pain or like they are uncomfortable, but it's actually a good that gag response is actually good. But we are giving medication to actually minimize that. So they might interpret it as something that not good for the patient. So they might feel uncomfortable when they see it.
Yeah, you're right. So it's actually a standard procedure. Tapi bila you
Yes, it's
ambil video, it
yes.
looks like, oh my God, something horrible is going on,
Yes,
right?
yes, yes.
Yeah.
Betul.
So, let lu tak payah ambil video. Yeah,
Betul.
that kind of thing. All right, let's take a look at the next one. Personal belongings, Doc.
Now, for personal belongings, simple familiar items such as glasses, hearing aids, as I mentioned earlier, photographs, or approved personal items can be helpful for the patient. However, valuables should generally be kept at home for safekeeping. Now, always communicate with the ICU staff if you're unsure about what you can bring and where you can't bring.
Okay, got it. And I think this is also very important because I think we're so busy taking care of our loved ones, we forget about ourselves. So, what advice do you have, Doc? I think this is a fantastic information.
Yes, this is what people usually forget. When a loved one is in the ICU, the family members, they are often focused entirely on the patient and neglect their own well-being. But as the saying goes, you cannot pour from an empty cup. You need to eat properly, stay hydrated, get enough rest, and seek emotional support. This is important because looking after yourself helps you better support your loved ones.
Yeah. I guess this is like, when we're flying, they always say if the oxygen mask comes down and you have a child with you,
Yes,
do not put on the child first, you put it on yourself because
betul,
you need to
betul,
take care of yourself. Because if anything happens, nobody's going to be able to help the child. The child's not going to be
betul,
able to help you.
betul. That's a very good analogy.
So think of it that day you have to take care of yourself, kind of thing, so that you can take care of the patient.
Betul.
Kind of Right. Let's take a look at the next slide. Okay, Doc, this is when, patients do not recover. What can you share with us about this here, Doc?
Now, this is not an easy topic to discuss as no one wants to imagine their loved one not recovering. However, despite our best efforts, some critically ill patients do not improve. Well, in these situations, our focus shifts from curative treatment to ensuring comfort, dignity, and compassionate care. Now, when death becomes imminent, we work closely with patients and their family to discuss the goals of care, support them through the difficult decision, and ensure that the care is provided is aligned with the patient's values, preferences, and wishes. Our priority at that point would be to reduce suffering, provide comfort, and support the process of dying with dignity, ensuring that patients are treated with respect, compassion, and dignity at the end of their life, while supporting families through this challenging time.
Yeah. Okay. So in your cases here, Doc, because you actually mentioned that not all pass away when they go into the ICU. You've got people coming out in their life. Like, what kind of percentage are we talking about, Doc? The ones who go on to live healthily.
I would say 70%, 70
Mm.
to 75% has a good chance of recovery. Yeah.
Okay. Okay. And the 30% too young do not recover. And this is where we need to know whether you support the life or, you let them die with dignity, I guess, right, Doc?
Yes, yes. As I've mentioned that I always feel that ICU is your last line of defense. You give you give all out when it comes to ICU. Then you will come to a point where you know it's beyond you. It's beyond the human punya ni capability already, and that's when we need to discuss with family members, and make sure that the patient dies with dignity. Yes.
Okay. So because it's a very fine line, yeah, Doc.
Yes, yes.
Yeah. So that one is if there is nothing else to do, that's when you guys start talking to the family, lah, is it?
No, we talk to family from day one. We will always we'll always update them on the patient's condition because the changes in ICU is very dynamic. They can be stable at one point, and the next minute they become unstable. So we communicate regularly with the family members. Yeah.
Okay. And of course, when you think there's nothing can be done, that's also communicated, right?
Yes.
So that
Yes.
means it's important to have open and honest communication, right?
Yes. Betul.
Okay, got it. Thank you, Doc. This is a very difficult slide in particular to talk about, right? Yeah. Okay. So now let's talk about the 70% who do go on to recover. What do we need to know about after ICU recovery, yeah, Doc? Because then it's a completely different thing, right, for some people.
Yes, betul. Now, leaving the ICU is a major milestone, but recovery often continues long after discharge. Some patients experience physical weakness, memory problems, emotional difficulties, or what we call post-intensive care syndrome. So recovery can take weeks to months and often involve rehabilitation, family support, and follow-up care. So family members must remember recovery takes a long time and not just ends with ICU discharge.
Okay. So any advice or message that you have for family members, Doc?
Regarding to ICU recovery. So always support your family members, and it takes it's going to be a long process. Having them being discharged from ICU is already a major milestone, a big success. But for them to get back on their feet and be like how they were before, that takes a long process. It can be up to months or even years sometimes.
Okay. So hang in there and also take care of yourself, right, Doc?
Betul. Yes.
Okay. So we discussed a lot of things, Doc. If we were to summarize this, what would be your take-home message for the audience out there?
So in summary, I would say the ICU is a place where highly trained teams provide specialized care to patients facing serious illness. While the machines and technology are important, compassionate teamwork, communication, and family support are equally essential parts of recovery. That's
Okay.
how I would summarize it.
Okay. And what in your opinion, what's the most important way family members can support the patient
I
during
would
an
say,
ICU? Yeah.
I would say to family members, just be present, communicate openly with the healthcare team, and provide reassurance and support to your loved one. Sometimes the simplest things, such as a familiar voice, a comforting touch, or just being there, can make a tremendous difference.
Betul, betul, betul. Because then you guys can focus on your work and we just
Betul.
focus on being present. I think we sometimes underestimate how being present is really important.
Yes,
Not
betul. Yeah, betul.
to be there, to have your time and not on the phone, actually be there.
Yes.
Okay, so thank you, Doc. I found this really, really insightful. What was your biggest learning in today's episode? Let us know in the comment section. For me, it was definitely that we need to take care of ourselves, definitely, because sometimes we get burnt out because we're staying awake all the time, and take care of us so that we can be better caretakers for our loved ones in the ICU as well. Yeah. Hope it sounds good. And the machines are not scary, by the way. It sounds like a lot, but it's supposed to help, kind of thing.
Yes.
And the third one I thought was really awesome that we need to remind ourselves is that 70% do actually recover, 30% don't. So it's not a death sentence when you go to the ICU. And the last thing you said was that the fact that they already made it out of the ICU is a milestone, and to me, milestone should be appreciated and celebrated. And
Yes.
that's how we continue living and providing support for our loved one. For me, yeah. Okay, sounds good. What did you guys learn? Let us know in the comment section. I'm going to switch things up a bit because we're going to finish a bit early because I need to keep my promise to Doc because she's got a meeting after this. So let's get into the quiz first before we go into the Q&A, right? All right, so it's quiz time. Now, today, as promised, mentioned in the earlier part of the show, we've got some awesome earbuds up for grabs. We've never had earbuds before. So if you want to win, what do you have to do? First, you got to be sure to share this video out at least 3 times. Remember to set the share post to public so that everybody can see. And next, answer the 3 questions that we're going to show in a bit on the screen and type out the answers in a single comment and you are on your way to win your prizes. What are the instructions? First, share the video out 3 times. Remember to set the post to public so everyone can see. And secondly, answer the 3 questions that we're going to show and answer it in a single comment, and we will select the first 3 winners based on the correct answers and the shared post. So are you ready? Let's take a look at the questions. Okay. So the first question is, the ICU provides 24-hour monitoring for critically ill patients. True or false? ICU provides 24-hour monitoring for critically ill patients. Question number 2. All patients in the ICU are on ventilators. True or false? All patients in the ICU are on ventilators. True or false? Question number 3. The patients in the ICU are encouraged to move and do physiotherapy when it's safe to do so. True or false? Patients in the ICU are encouraged to move and do physiotherapy when it's safe to do so. All right, let us know in the comment section. In the meanwhile, let's go into the Q&A. Okay, Yiki has a question. Are ICU medications different from those given in a regular ward? Good question. Doc, can you help us?
Yes, the care provided in the ICU is definitely different from what's provided in the ward because the monitoring are more advanced and the procedures done are more invasive. So they require intensive monitoring.
Medications pun lain ke?
Medications pun, some medications cannot be used in the wards. The ones that be used in the ICU, some of them cannot be used in the wards because they need invasive monitoring, some of the medications.
Okay, got it. Nor Farhani Putra has a question. Dok, apa tanda-tanda seorang itu memerlukan rawatan di ICU? This is a good question because, sometimes a lot of cases I hear dia berhantar lambat. So what do we need to be aware?
So, tanda-tanda seorang memerlukan rawatan di ICU. So basically, patients who needed ICU care is patients who are critically ill. They are seriously ill, they are unstable, their blood pressure can be very low or can be very high, and then they have multi-organ involvement. Maksudnya their liver is failing, their kidneys is failing, their lung is failing, their heart is failing, yeah. So they need advanced support which cannot be provided in the wards. So
Okay,
that
got it. Kalau
basically,
kat
yeah.
rumah, kalau kat rumah, if you see something off je hantar, is it?
Yes, yes. That kalau kat rumah, patients, people, anybody who's unwell, then go to ED and they will assess you from there. If they think you need ICU care, they will refer from ED itself.
Okay, got it. Right. So next question also from Yuki. How do doctors decide when a patient is ready to leave the ICU? This is a great question.
So there are actually criteria on deciding whether a patient is ready to leave ICU. Number one that I would like to mention is they have recovered or on the recovery from their primary injury, primary illness. For example, if they have infection to the lung, right? They have pneumonia. They are actually recovering from that pneumonia. They don't need that breathing tube anymore, and their organ has started to recover. Those are some of the tanda-tanda that a patient is recovering. When they are already stable and they can be monitored in the ward, contohnya tube dah tak pakai, oksigen pun very low, oxygen support yang diperlukan pun very low already, or tak perlu oxygen support anymore, then probably we will assess and see whether it's safe to send them to the ward.
Okay, got it. Okay, ni question yang just now, Muhammad Syamil was asking when we were talking about the mobility and the rehab kind of thing. Doktor maksudkan ditidurkan tu macam mana?
Ditidurkan ni term yang famous since COVID era.
Oh, okay.
Ya, ditidurkan. So actually patient tak ditidurkan. Patient is actually we give sedatives to reduce anxiety, to make sure they are comfortable, so that we can give interventions which are a bit more invasive. So kalau kita sedar kan, orang yang sedar, kita masukkan breathing tube, they'll be very traumatic and uncomfortable. So we will give them sedatives to make sure they are calm, they are rested, so that intervention can be done. So sebab masa COVID tu kan, ramai yang ditidurkan, ramai yang perlukan breathing tube. So the term used tu senang je, ditidurkan. Maksudnya pengsan, lepas tu kita masukkan tube. That's why they say ditidurkan.
All right, so okay, now I get it. So I thought it had to do with the rehab or the mobilization. So ditidurkan would be sedated lah, right?
Yes,
Okay.
yes.
Yuki's next question is, how long will delirium last? Good question.
It depends. It's actually temporary and it depends. Some patients, even by days, they are usually recover. But most of the time, I would say about a week or two macam tu. Yeah, it depends on them. Depends on the patient. As the patient recovers, as their illness resolve, then they will become better. They will recover from delirium also.
Okay, got it. Okay, so Mimi Musa doesn't have a question, but she actually said part number yang visitor ni agak susah nak control, which is betul sebab kita Malaysia. Orang Asia yang bukan datang seorang, kita buat lawatan Cik Kiah, betul tak? Any advice or comment on this, Doc?
Tapi itulah, ingat, the more people comes, the higher the chance of patient getting an infection. That's why, and then it interferes with the patient's punya recovery process. Sometimes they need rest, right? And because it's intensive care, so the intervention is intensive. It's like almost all the time lah maksudnya. Kan, kalau ada orang melawat je nanti it becomes interrupted. So siapa yang rugi is the patient actually.
Yeah. So think of it mindfully lah. Thank you so much for that advice. Yeah, Doc. Okay, Nadia Idris had this question: how are family members kept informed about a patient's progress?
So bila family members comes for visiting hours, right? We will update them on their condition. That is like routine, like daily we will update. But there are times when we need to update a few times a day, especially when they are very unstable. We will always keep them up to date on the patient's condition.
So family members are updated when they are there and visiting the family, when they are there
Yes.
at the hospital.
Yeah, that's the routine yang we usually do. Every time datang visiting hours, then we will talk to family. But sometimes kalau patient are very unstable, right? They need to be there all the time. Then we will keep updating them on the patient's
Okay.
condition.
Okay, got it. So I'll quickly ask you the 6 more questions before we answer the apa ni, the quiz question.
Okay.
Winners pun belum announce lagi. Okay, so the next question is from Aizul. I think dia ni nak jadi doktor atau in the medical field, doktor. Kemahiran yang paling penting untuk kerja kat ICU tu apa, doktor?
Untuk kerja kat ICU ya, kemahiran yang paling penting.
What's the important skill? Communication, empathy. Macam mana tu, dok?
I would say, tak nak bekerja dekat hospital ni, saya rasa the most important thing is you have to be hard working. You have to be very diligent. You have to be very meticulous when it comes, because it's humans' lives. Yeah. It's
Okay, so kena
human
detail,
life. You have to be very hardworking and
Okay,
diligent.
got it.
Yes.
And kena tahan kan, because sometimes I hear that you guys are on call 24, 36 hours, is it?
Yes, that's why your family support is very important. Family support and emotional support is very important when when dealing with critically ill patients. You
Okay.
yourself have to take care of yourself. Yeah.
I think that's a good one. So if you want to work in this line, you need to understand that you need to take care of yourself as well,
Yeah,
because
betul.
you need to take care of people. It can be very draining. Okay,
Yes.
this is a good question also from Nadia. What is the difference between ICU and HDU? HDU tu high dependency unit, doc.
Yes, sometimes some hospital they have HDU. It's actually it's between ICU and general ward. So it's somewhere in between. You may not be very ill, but you have the potential of becoming more ill. So you might not need ICU care, but you may need high dependency unit care. And sometimes patients who are in the ICU, they are more stable. They may be transferred to the HDU. It's like a step down unit also.
So it's a
Yes.
step down. Okay, got it.
Yes,
Okay.
between the general ward and the ICU.
Okay. Guat Hua ada question, why some patient can get hospital acquired infection? What is wrong? I think I want to ask combined with this question. So why some patient can get hospital acquired infection? What is wrong? And Sakina's question is it true that some patients expire due to infection in ICU because of low immunity and not due to its actual case?
There is some
Under
truth to
risk,
that,
right?
betul. Because when you are critically ill, right, your immune system is very low. And then your organs are all failing. So you are very prone to get hospital-acquired infection. It is not something that I would say uncommon. It is quite common. And you are exposed to high-end antibiotics. You need high-end antibiotics to fight this very severe illness. So you are prone to get infection from hospital lah, maksudnya. That's why tu saya cakap apa ni, bila pelawat datang kan, you need to do that hand hygiene thing. When you touch the environment, you need to do hand hygiene. When you touch the patient, before you touch and after you touch pun you kena buat hand hygiene. So that's where hospital acquired infection is ni lah, quite important.
Those two are very good questions. It goes back to the visitation guidelines, because these people have lower immunity, so you need to take care and limit your visits, because you got to be mindful of the patients who are there, kind of thing. All right.
Yes, even as healthcare workers pun, between us, when we touch a patient, before we go on to the next patient, we have to wash our hands and wear gowns when we touch patients.
Okay, got it. So next question is from Bunhan. 2 more questions before I announce the winner. Bunhan's question is, what are your thoughts on mobilizing an intubated patient? Is this practice currently used in Malaysia?
It is being practiced in Malaysia, intubated patients who are stable. I have the opportunity to actually see this being done when I was doing my training in Hospital Ipoh and also HKL. We move intubated patients. They are on breathing tubes, but their support is very minimal. It's safe to move them. We sometimes move them to the chair, even in hospitals Tanah Aminah Johor Bahru also. We do move patients to the chair, even when they are.
Okay, and the last question is from Alina Tan. Hi doc, what advice would you give patients who feel anxious about undergoing anesthesia?
I would say, don't worry. We will do our best for you. Don't worry. Uh, in today's age and time, anesthesia has been very safe because
Mm.
monitors are being developed to actually monitor patients who are anesthetized. So don't
Okay.
worry. Yep.
All right. So technology and advancement is already there. You
Yeah.
can be sure that it's no big deal. Okay. And this, I'm pro because I don't want to feel anything. That's all I can say. You don't even wake up, oh, I'm sorted. That's what I believe. Anything that helps with that, I'm pro. Okay. All right. Okay. So next, all right. So we're done with the questions. Let's take a look at who our winners are. But before we take a look at the winners, let's find out what the correct answers is. Now, if you can help me, the first question is: the ICU provides 24-hour monitoring for critically ill patients. True or false?
So the answer is true.
Yeah, betul, 24 hours. Next question: all patients in the ICU are on ventilators. Ya ke dok? True or
Now this
false?
is false. Definitely
Yeah.
false.
Kalau you masuk ICU tak semua macam ni, okay?
Yes.
Patients in the ICU are encouraged to move and do physio when it's safe to do so. True or false, doc?
This one is true.
Yes. All right. So the correct answer is, well, let me just announce the winner. The winners of the quiz are Jasmine Liu, Elvin Lam, and C Stars. Congratulations.
Congratulations.
Hey. All right. So if you are Elvin Lam, Sea Stars, Jasmine Yu, just hang in there. We're going to be sending you a message, giving you details of how you will be getting your prizes. Congratulations to our winners. All right. Be sure to check your Facebook in Messenger inbox. All right. So that's all the time that we have for today. Thank you so much for joining us today. I definitely learned a lot. I hope you do too. Let us know in the comment section what you learned. And thank you so much for Doc for being with us today. Right? Let's
Thank
give her
you.
a
Thank
round
you.
of applause, shall
Yeah,
we?
thank you, Nina.
Well,
It's a pleasure.
yeah, okay. So, okay, that's all the time we have for today. If you know someone who's really going to appreciate today's information, please send them the link, share your insights, because you never know. You might just help. I think a loved one would probably benefit from this episode more, as well as if you're a patient, because 70% of people actually do make it out of the ICU. That's pretty huge number, right? So if you think this episode has been useful, let us know. Give us lots of likes and comments and send us a lot of love. In the meanwhile, take care of yourself and each other, and we'll see you in the next episode of Doctors Go Live. Thank you from us. Bye.